definitely seems to work for adults, so it should be okay for kids.
Big step today. Pfizer announcing that its COVID vaccine does work in kids ages 5 to 11.
Pfizer says the lower dose for kids ages 5 to 11 is safe, well tolerated, and prompts a robust immune response. The company says it'll soon seek emergency use authorization from the FDA. Thanks for joining us at 5. I'm Christine Sorensen.
I'm Ken Rice. Some parents are on the fence about whether their kids will get the vaccine. Amy Wadas joins us now with some reaction from local families. Amy.
Doctors say there are still several steps that need to take place before we see the COVID-19 vaccine available to young kids. Meantime, some people we spoke to today say they cannot wait for it, while others say they're still not so sure. Heather Smith of Altoona says she wants her 5-year-old grandson vaccinated once the shot is available, but says her daughter might be standing in the way of that.
She's having issues with the vaccine, worrying about future side effects of them, but I try to probe her into getting into it.
Smith's biggest concern right now?
We're from Blair County, Altoona area, and it's spiking there in kids even. So absolutely it worries about, I worry about them going to school.
Being back in school this year is a top concern for health experts as the Delta variant continues to spread.
This is going to expand the number of children that can be protected against COVID-19.
But before kids 5 to 11 can roll up their sleeves, Dr. Edward Katayer with Allegheny Health Network says Pfizer's shot for young children still has several steps to go through before it's approved.
The FDA, the CDC, and the American Academy of Pediatrics need to look at this data and decide for themselves how and when this vaccine should be given to kids between the age of 5 and 11.
Katayer says we will likely see the shot available through emergency use authorization before it's approved by the FDA. But he emphasizes that shots under emergency use authorization are safe.
Emergency use authorization is about as good as we're going to get. I think it's good enough. Parents don't want their children to be hospitalized, and the rate of hospitalizations in children have gone up significantly.
As for Heather Smith, she said she understands why her daughter is hesitant, but she said she'll keep pushing the shot as long as she can. Dr. Katayer says we could see the COVID-19 vaccine for kids 5 to 11 available as early as Halloween, but he thinks realistically that might not be until Thanksgiving. Meantime, coming up tonight at 6, Dr. Katayer talks about the difference between the dosage for the 5 to 11 age range and what this means as far as side effects go. Reporting live, Amy Wadas, KDKA News.